Let's go. Let's keep it in the KUM News Zoom room where we have Diana Calvo, the head of Catholic Social Services, standing by.
She's got to unmute her camera.
Right, so
Okay.
Diana Calvo, she's with Catholic Social Services, as Chris mentioned, and Monsignor David Quitugua, right?
Yes.
He just passed away. He was the actual founder of Catholic Social Services. And so thanks, Diana, for coming on the show this morning and talking about, some of the work that you guys have continued to do over at CSS, and also just sharing, your memories about Monsignor Quitugua. Thanks for coming on.
Good morning. Thank you for having us.
Of course, and I will just start there with Diana, because I know that we brought you on to talk about the Safe Haven homeless shelter, but obviously this announcement late yesterday about the passing of Monsignor Quitugua, we do want to get your response as Catholic Social Services.
On the Safe Haven or
on Monsignor Quitugua's passing.
Oh,
Yeah.
well, we're very saddened by the passing. We've been, we were aware that he was admitted to the hospital, and we've been praying for him. I've met Monsignor when he was still Father David Quitugua in 1979. And, when the Archdiocese referred to him as a gentle priest, that is very reflective of his person, because he was a very gentle soul. And when I came into CSS, we had more frequent contact. He was always very, very gracious to come and say Mass for our client groups. And his sermons to us, which included, clients, staff, our providers, have always been very on point in terms of the work that we do. And, we've had some really good chats, conversing with him at the rectory, and him sharing, his thoughts on what's transpiring in the new years, if you will, the differences between then in the 70s and what's happening now, and he's a very intelligent person. And, I personally will miss him because he's been very gracious and very giving. He is, he was the first executive director of CSS, and he was also a board member. So he is an emeritus board member, as well as emeritus executive director for CSS. And every opportunity that we have, we invite him, and he always makes a point to come, which really just shows, his commitment to the work that he started, which he started really with love, and sorry, I'm just, but yeah, we will miss him. And, we have staff that's reached out to the family to just offer our support for whatever that they would need.
We know that Monsignor was sick, Diana, but did you anticipate that his passing would come this quickly?
Well, he had slowed down, and as even some of the administrative changes were occurring, within the Archdiocese, he still was very poised about some of the decisions that were made. In sharing, he accepted it. It just gave him the opportunity to prepare more, I think. But he was never he was never negative about anything, really. In all the years that I've had interaction with him and things were pretty, going bad or whatever, he never at least projected anything negative, and just, said we need to find a better way. And that was how he redirected, how we focus our energies into coming up with other options instead of just dwelling on, the issues at hand.
What are some of the other lessons that Monsignor Quitugua's life has taught you? Obviously, Catholic Social Services. I mean, that's where he came up.
Well, he's a Catholic priest, and it's really tying in prayer to support people in what they're going through. And even though we, over the years, CSS has employed individuals of other faith religions, and we would have either a prayer service, still tied into maybe our Catholic religion, but also recognizing other faith-based groups that CSS works with. And above all of that, it's really just embracing a level of spirituality to be able to refresh us. So it doesn't matter what kind of, even if you're not a religious person, but if you have a level of spirituality and you reflect and you meditate, then it helps a person to come into perspective. And then in doing that, it provides some level of clarity on how we can approach, whatever it is that we're having to address. And, I try to mirror that to the staff by providing them, with those kinds of encouragement, prayers and meditation. And particularly now in this COVID environment, it's also reassuring staff because we continue to do our work amid the risk of exposure, and we're doing what we can to calm people, even our clients, and to reassure them, that we're available to help them depending on what it is and how we can help them in that regard. And, it's helping, at least for our employees, it's helping them to kind of be able to, move through what's happening, because we've had those effects in our within our employees' families. They've had staff, their own members who have lost their jobs or are furloughed without pay. We have staff that have family members that have been exposed to the virus. And so, the reflection, the prayers, I think that all helps to strengthen us every day so that we can approach our work with the thought that, God's going to protect us, really.
Right. Diana, I mean, obviously, Monsignor Quitugua beloved by thousands on this island, but with this pandemic and these restrictions that are being placed on funerals, how hard do you think it is going to be for the people who want to say goodbye to Monsignor David Quitugua when they just simply can't through the way that we always do in our culture, which is with the funeral?
I don't know. I know that the chance to see him, for the last time, to see, probably is not going to happen, but to be a part of the services that, honor him, I think, people will have a very difficult time coping if they're not able to be physically there. For CSS, I mean, we will help the family in however way we can. And while we recognize that, as much as we would like to be there, and our board of trustees, including those that are still alive who were part of his initial board of trustees and directors, who would want to be there, at the very most, we can offer him prayers, and be with him in spirit, really, because I know he would not want his funeral to be a cause for other, grief or sorrows. And so I just hope that, whatever transpires in the decision, that the community will find a way to respect the wishes of the family, particularly if Monsignor had wishes, and if that's going to be communicated, then at minimum, we honor him by complying with whatever is his request.
Diana, let's switch gears here to the Safe Haven homeless shelter. If you could just give us an update. We heard this was a little alarming that there's from Lieutenant Governor, we heard there's a waiting list to get into this shelter. So just if you could just status update us on the Safe Haven homeless shelter in MTM.
Well, so the the safe haven was, I guess it, for lack of a better name, was focused on sheltering, providing a shelter for those who are street homeless. And based on both HUD and CDC recommendations, the highest recommendation for how to address street homeless was to put them in a form of housing where they are able to self quarantine in their own space. And so, there were other designs, I think, that were identified, and they were looking at resources that are available on Guam. And so the Global Dorm apartments in Mighty, I guess, was that option to implement. CSS is only contracted to provide shelter supervision and case management. All of the other logistics are taken care of by the government. It is, I guess, facilitated by several staff, including Department of Public Works and the staff from the Lieutenant Governor's office. And so we open in the latter part of July. There's 39 rooms that we place individual families. And our focus is two parts. So one, the families that we brought in, we provide supervision. We coordinate what are their services needed. We coordinate whatever access to public assistance benefits and so forth. And then we start to initiate that for more public housing options, more permanent housing options. Since July, we've sheltered a total of 122 individuals. We currently have 27 families, totaling 72 individuals. And the composition of those households include 2 families with newborn children, to an elderly couple that also has an adult child. Most of the individuals that were initially sheltered lost their jobs due to the pandemic. So we did have street homeless who were working. They just didn't have a place to stay, but they were working. But we still have people who are working. They're just not able to, with their reduced hours or whatever is the situation with their employer, they're not able to afford rent. And so this gives them an opportunity to still keep their job and be able to either build up their savings while we try to determine if they're eligible for other housing subsidies. The focus for us is not necessarily on GURA housing, because we already know that, most of the vouchers have been issued. But if a person is eligible and we make the referral and they are one of the few that are already on the wait list, then, they would be the lucky ones. And we actually have 5 families that are waiting for their GURA paperwork to be processed. There's things that are already in place, and I think we're just waiting for GURA to either schedule a review of the packets and then to also schedule an inspection of the units these individuals will be moving into.
Right. Well, really, Diana, it's good to hear the work you guys are doing. And although, this is just a small, I guess, amount of people because of street homeless, because we know that, there's a whole lot more people out there that are in need of help. So I guess, we have to do, and this is only just for the state of public health emergency, right?
Yes.
I think that's what Mr.
And
Sakazaki said.
it is geared towards, trying to mitigate the exposure of the virus to transient individuals. Mm-hmm. And so even before that, CSS was doing outreach, and we've been handing out actually masks and bar soap and hand sanitizers, and just finding, and we brought our nursing surveillance team mm-hmm. to just do some checks to make sure and educate people about what's available and what's mm-hmm. happening. And when the dorms became available, we surveyed those individuals, and asked if they would want to stay in housing, at least for the short term, so that they also have a roof over their heads. And for some, they accept it. For others, they're not wanting to leave their space. So we still keep in touch with those individuals that have not accepted to be housed.
All right, Diana, thank you so much. Chris, did you have anything you wanted to ask? Or good?
Well, I did want to ask Diana because I heard that some people have been, I don't know if this is the right word, kicked out of the homeless shelter. Can you talk a little bit about that?
Yes. So, we, even though we're sheltering individuals, we do have some house rules.
Of course.
And when we brought in people, there's we have to, so the effects of, I guess, the stress that's brought on by a lot of different things is highlighted when you're in a congregate setting. So we've had drama, if you will, between couples.
Aye.
Some of it has become physical. And so we have evicted individuals who are not complying with the house rules. Our most recent evictions really was when PCOR 1 was implemented, and we kind of locked down the shelter,
Right.
and those that are employed or having to go to the doctor's appointments and all that, they're allowed to come and go, and we do the screenings before they re-enter the complex. But we've had individuals that sneak out or were very defiant and said, no, you can't force me to stay here, I'm going to go. And so when they left, and we don't know where they go to, we cannot afford to expose individuals in the unit, because even though they're occupying single rooms,
Right. They're
the
still
main
interacting
entries
with
and the hallways
yeah.
are all,
common areas.
common areas.
Right, yeah.
And so, for CSS, infection control and sanitation is always big. The COVID is just adding another item for us to be on top of. But, for CSS, we've been very strict about making sure people do not present themselves with any kind of infectious disease.
Mm-hmm.
And we have people that have said, upon entry, we're going to have to quarantine you from the others for at least 14 days, so that, if you do have whatever symptoms and we get you checked, we don't want to have any kind of exposure. And some people do not want to be quarantined. And so, if they're not wanting to comply with simple rules like that, then, which are really safety rules, then, we cannot afford to have that affect the safety of everybody else, including my staff.
Right. Good call,
So
Diana.
I think in total, we probably evicted 3 families. We've evicted an individual from a family, so the family is still at the dorm, but the person that caused the incident was evicted. And for those that have really uncontrolled alcohol issues, we're not allowing them to come back in until they accept to follow the rules.
Wow.
And, unfortunately, our proximity of the dorm, we're kind of behind a complex that also has, I guess, like a bar. So even though they're closed, these individuals still find a way to consume those alcoholic beverages somewhere else, and they come in drunk.
Well, it's unfortunate, Diana. That I guess comes with the territory, right?
Well, that comes with the territory. And, if we were dealing with adults only, there could be certain exceptions, after they've slept it off and all that, we may
Right.
have readmitted them. But we also have families with children, and we have 2 families with newborns. And so, we're needing to focus the priority really on the families with young children. And so it does take a lot to make sure that the supervision is tight. And we have no exceptions for any kind of deviation from the safety rules.
Right on. Diana, thank you for coming on and, remembering Monsignor Quitugua and also telling us a little bit more about the operation there at the Safe Haven. I appreciate your time.
Thank you.
Okay, Esther, wash your
Have a
hands.
good day.
You too. You too, Diana. Bye.